In medicine, your pen can often be more powerful than your scalpel, especially when you find yourself in a courtroom. So today, we're going to build your legal defense one note at a time, really focusing on the entries, the timing, and the details that will actually protect you.
Now, this isn't just some catchy phrase they teach you in medical school. It is the fundamental rule in the world of medical law. In the eyes of a court, if you didn't write it down, it simply never happened. Your notes don't just describe what happened. In a legal setting, they are what happened.
Think about it. These records are so much more than just notes for your own reference. They are the primary evidence a court uses to piece together events and judge your actions. Meticulous documentation has literally saved careers. And on the flip side, poor documentation has ended them, even when the actual medical care was perfectly fine.
So, the big question is, how do we turn a simple clinical note into a rock-solid legal defense? Let's take a look at the blueprint for doing just that.
A court is really looking for a complete and accurate story. Were your notes written down in a timely manner? Are they clear, consistent, and maybe most importantly, do they actually show your thought process, your clinical reasoning? When all these things are there, you create this transparent record of good, diligent care that's incredibly difficult to challenge.
Okay, now let's zoom in on the specific entries that carry the most weight. You can think of these as the actual walls of your defensive fortress. These are the sections that will be put under a microscope.
It all kicks off with the patient's story. Writing down their main complaints, and if you can, using their own words, is absolutely crucial. But just as important is documenting what we call relevant negatives. Noting what the patient denied having proves that your line of questioning was thorough right from the get-go.
Next up are your objective findings. The court will painstakingly compare your recorded examination findings to the decisions you made after. You see, any little inconsistency here can create a huge vulnerability. So clear, precise recording of vitals and all your findings is just non-negotiable.
This is where you really get to show off your clinical judgment. Look, just stating a diagnosis is not enough. You have to document the other possibilities you considered, the differential diagnoses, and, this is key, explain your reasoning for ruling them out. This clearly demonstrates a sound and systematic thought process to the court.
Every single order needs a reason behind it. Why did you order this test? What was the goal of this medication? Documenting the why is essential. And you have to be precise. Medications, dosages, timings. Even one tiny undocumented step can be spun to look like a deviation from the standard of care.
All right, let's talk about communication and consent. Honestly, this one area can single-handedly determine the outcome of a case. Your notes have to show that you explained the risks and benefits, you talked about other options, and you gave the patient a real chance to ask questions. You have to document not just that you got consent, but the important parts of the conversation that led to it.
And listen, your responsibility doesn't just stop when the patient walks out the door. Documenting your follow-up advice is one of the most effective, yet so commonly overlooked legal protections. Be specific. What warning signs did you tell them to look for? When exactly did you say they should come back or seek urgent care? Okay, so we've covered the what. Now let's look at the how, the procedural details that really bind everything together. These are the things that make your documentation credible when it's under the intense pressure of a legal review.
Of all the factors we're talking about, timing is arguably the most critical. Notes made at or near the time of the event, contemporaneous notes, carry the most legal weight, period. Any attempt to backdate an entry is seen as tampering, and it can absolutely destroy an otherwise perfect defense. If you have to add a note later, you must always mark it clearly as a late entry with the current date and time.
Look, we all make mistakes. Legally, what matters is how you correct them. Never, ever use whiteout or try to erase something. That just looks like you're trying to hide it. The legally correct method is simple. Draw a single line through the error so it's still readable, write the correction, and then initial, date, and time it. That's it.
It's a simple truth, really. If a judge or a jury cannot read your handwriting, they can't consider it as evidence in your favor. An illegible note is, for all legal intents and purposes, a non-existent note. Make sure your writing is clear and try to avoid any ambiguous abbreviations that could be misinterpreted.
All right, let's shift our focus to the common errors we see. Knowing where the pitfalls are is really the first step in avoiding them, and making sure your documentation is as strong as it can be.
So let's ask a very direct question that every single clinician should think about. Where are the most common weak points? Where do good, well-intentioned doctors find that their records are failing them when they're put under scrutiny?
The road to a strong defense is, unfortunately, littered with these common pitfalls. These are the exact gaps and omissions that plaintiff attorneys are trained to find. Every missing timestamp, every incomplete history, every unrecorded conversation about risks. It's a crack in your defense, an open door for a legal challenge.
And finally, always remember the tone of your writing. You should imagine your notes being read out loud in a courtroom, because one day they might be. Stick to objective, factual language. Avoid blaming anyone, avoid speculating, and definitely avoid using emotional words. Just let the facts of your excellent care speak for themselves.
So, we'll leave you with this one question to really think about. Is your daily documentation practice not just a clinical tool, but a powerful legal shield, ready to defend you if you are ever called upon to do so?
Your Med Lawyer, protecting doctors, empowering patients.